So how can genomics help? Well, think of this test as a snapshot in time where you have a patient in your office and you want to know what is the percentage likelihood that at that moment that they're in your office that they have an obstructive lesion in their coronary artery. So this test is designed for people in the office with stable symptoms, not unstable symptoms. This is not a test designed to be used in the emergency department if somebody has new onset angina. It can also be used in people that have suspected coronary disease with 2 or more cardiac risk factors. Not really a screening test, but really a test to assess at that moment, do they have obstructive coronary disease. These are patients without a history of myocardial infarction or coronary disease. These are non-diabetic patients and patients that do not have active inflammatory or infectious conditions. And you'll see why here in just a minute. Another exclusion would be people that are not taking steroids, immunosuppressive agents, or chemotherapeutic agents. So this is a clinically validated gene expression test, and I can't emphasize this enough. It is gender-specific and age-dependent when it looks at risk functions in the analysis. It's measuring levels of gene expression surrogates for cell types in blood. Think about the inflammatory system, leukocytes, different types of cell types there. And it's also looking at changes in gene expression within a given cell type. So this is a dynamic test. This is not a genetic test where you're born one way and you have the same score throughout your life. This test can change over time. The algorithm is comprised of 23 different genes, and these are just a few examples of where these genes come from. They can come from T cells, monocytes, B cells, natural killer cells that play many different and varied roles in the immune response to injury at the coronary arterial level. So you order this test. What happens next? Well, if you live in Tennessee where I live, approximately 48 to 72 hours after you order the test, you get this piece of paper faxed to your clinic. This is a patient report, and what you see on it is this nice little graph on the left that depicts the relationship between the test score that you get and the percentage likelihood of obstructive coronary disease as seen in the validation study. The black line in the middle is the absolute percentage, and then the blue lines above and below are the error bars that tell you within a 95% confidence range what is the percentage likelihood that you would have seen with this score, with that age and gender in the validation study. The score ranges between 0 and 40, with a higher value representing a higher likelihood of coronary artery disease. But really just focus on the percentage more than the absolute score, I think, when you're using this test clinically.